My name is Tiffany Henry, and I am going to be demonstrating IV therapy. So my patient today is Shirley Coast, and she's been admitted for dehydration. I have already gone into the med room with my doctor's orders and my MAR. I have collected all my supplies and my medication. I have done the 2 medication checks already, and I have entered the patient's room. I've done hand hygiene, and I've provided privacy. So, hi Shirley, how are you today? Good. So the doctor has ordered some lactated ringers to help you with the dehydration today, and we're going to do this via IV, okay? Good. Have you ever had an IV before? You have? Awesome. So Shirley, are you right-handed or left-handed? You're right-handed? Okay, so we can use your left arm. Perfect. Okay, so what I'm going to do is put some gloves on. And Shirley, before I get started, if you could do me a favor, if you could verify your name and date of birth. Shirley Coast, 4/3/1987. That matches Shirley Coast, 4/3/1987 on my provider's orders, as well as my MAR. Good. And Shirley, do you have any allergies? Codeine? That's what it says on her band, as well as her MAR and on the doctor's orders. Okay. So, Shirley, what I'm going to do is I'm going to open up my ChloraPrep kit. Okay. We're going to see if we can find a vein. And we're just kind of assessing her arm a bit here. Oh, looks like we got some good ones over here. Okay, so Shirley, what I'm going to do is take a tourniquet, and I'm going to put this under your arm. And it's going to be just a little tight because this helps pop the vein up for me, okay? Perfect. And Shirley, while I'm doing this, do you have any questions for me? You don't? Okay. I'll talk you through this as we go, okay? Perfect. So, I'm going to palpate for a vein. And this looks like a good vein right here. Okay, so I'm going to release the tourniquet. And I'm going to get my ChloraPrep and open that. And I'm going to clean the site, pop it. And we're going to clean 15 to 30 seconds. I don't want to get a big area because we want to make sure that it is really clean so that it does not introduce any antimicrobials or bacteria into the vein when I stick her. Okay, and while that's drying, I'm going to go ahead and I'm going to get prepped with my other steps. So I'm going to take the saline lock, and I'm going to get this prepped. And I'm going to take 3 mils of regular saline, and I'm going to insert it into the end, twist. I'm going to take off the blue cap, and then I'm going to pull back a little bit to release the pressure. And I'm going to get just a couple to see if I can get primed. And it is dripping. I want to make sure I have no air bubbles. Okay, so I'm going to put this back because this is a clean technique. We're just going to put it right back there and let that sit. I am going to open up my catheter needle and get it ready. So Shirley, you're going to feel a little poke when we insert this, okay? And I've got the blue check to make sure that if we have any spill of fluids or of blood that it's caught on there. Okay. So we've allowed her arm, whoops, these gloves. We've allowed her arm time to dry. Okay, and I'm going to take off the cap to my needle. And I want to make sure that I am bevel up. Okay, and then we're gonna go in, oops. I'm gonna go, there it is, bevel up. I'm gonna go in at a 15-degree angle. And I'm gonna go in at a fourth, and I've got a flash of blood. So now I'm going to go ahead and I'm going to advance the needle. And I'm gonna put pressure right here. And that goes in the sharps. And then I am going to take the tourniquet off. And I'm going to connect my saline lock. And at this point, I'm going to go ahead and I'm going to push fluids to make sure that it's patent. And it is. So then I'm going to go ahead and take this off. And I'm going to get my tape. And we want to make sure that we tape this. Don't you do it. I don't want to go over the hub, but just right there below. And that secures it. And this also keeps anything, it keeps it occlusive so that water cannot get in there. And I'm going to kind of assess the site, make sure everything looks good. Shirley, are you having any pain at all? No? Just a little pinch? Yep, and that's all done. Okay, and I'm going to take my tape that I already had prepped, and I'm going to pull this up, and we're going to tape this down because we don't want it going all over. Okay, and at this point, I am going to write, I have a pen, I'm writing the date and the time that I did this, as well as my initials. And I'm going to put this right here so that the next nurse will know. Okay. So, if you're okay for a moment, Shirley, I'm now going to go and I'm going to prep the IV fluids. So I'm going to get my MAR. And my doctor's orders, and the doctor has ordered on my third med check, we are going to administer the lactate ringers IV at 150 mils an hour. And I open my bag. I'm going to inspect the bag, and I'm going to squeeze the bag a bit to make sure nothing's coming out anywhere. And I have lactated ringers, 1,000 mils, which is what matches my doctor's orders, as well as the MAR. It is clear, there's no particles in there at all. So I'm going to get my label, and I'm going to write the date and time on it. And this has Shirley's name on it. And we're going to slap this on there. And now I'm going to get my tubing. This is a primary tubing. It opens at this end. And we are going to try to undo this so that it does not tangle. I'm going to take the top off of this. And I'm going to spike my bag. Okay, and then I'm going to hang my bag. And now I'm going to prime it. So as we let everything. Okay, so I'm going to fill Minnesota. And I'm going to open it up. I'm going to take this off, keeping the end in my hand. And Minnesota has filled, so I'm going to flip it upside down. And I'm going to prime. And then I'm going to close it back up. We've gotten drips. I have no air bubbles in my line. And I'm going to go ahead and I'm going to set this right here. And I'm going to get an alcohol prep. And I want to clean the hub because it's been open to air and we want to make sure. Do this for about 10 to 15 seconds. And then I'm going to go ahead and connect. And I'm going to take another piece of tape that I already had prepped. And I'm actually going to tape this up here just a little bit. This way it doesn't get, if they're moving around, it doesn't pull down here. And then I'm going to take another label and I'm going to date and time with my initials. And I'm going to put this on my tubing. And I would have primed my chamber first. Okay, so now I'm going to document the time that I did this and all the information that I need. I'm going to, with my initials, the time we did it, and the time that we started. And I'm going to let Shirley know. Shirley, let me know if you have any pain or if any redness or any kind of burning. You need to let me know right away because we want to make sure that we have no phlebitis, no infiltration. And I would come back and check on this every 4 hours unless the patient noticed something and called us in. And then I would leave the room. And now the doctor has given orders to discontinue. So now I'm going to discontinue the IV fluids. So I'm back in the room. I've confirmed my patient again, name and date of birth, and I've done it to my orders. And, okay, Shirley, we're going to go ahead and we're going to stop your IV. So now I'm going to close the chamber because we want to stop the fluids. And I'm going to get my 3 mils of saline ready. And to get the tape off, it always works with alcohol. That way it doesn't pull so much on the patient's skin. Okay, so we get that one. And then we're going to go ahead and take this one. And again, we're going to pull gently so that we don't tear the patient's skin or hurt the patient. Just doing it gently. And again, using the alcohol to help. And I'm going to apply pressure right here. And I am going to get my gauze. Kind of hold that there for a moment. I'm going to go ahead and I'm going to disconnect. And I'm going to put the top back on here. And then we would hang this. And I'll open my 3 mils of saline. And we're going to flush to make sure all the medication's in and for patency, just in case the doctor decides they want to do another one. Okay, I'm going to pull back and then I'm going to push. Okay. And then I'm going to go ahead and undo this, throw it away. And then we're going to go ahead and discontinue the saline lock and take this off. And I'm applying pressure so that it doesn't bleed. Garbage. And then I'm going to pull the catheter straight out. While I'm applying pressure for 3 to 5 minutes, I'm going to go ahead and I'm going to look and see that the tip is intact. And I'm going to put that in here. Okay, Shirley, I could have the patient hold this, or I could put tape on it. It's been 3 to 5 minutes, so she's no longer bleeding. And Shirley, do you have any questions for me? No? Nice to have that out. Yes, it is. I'm going to go ahead, I'm going to take off my gloves. I'm going to perform hand hygiene. And I am going to go and I'm going to document the stop time. I'm going to document that the tip was intact and that the patient tolerated well.